Welcome back. This is part 31 of things that your vet staff wishes that you know, and in this video we're going to talk about hip dysplasia. Hip dysplasia is essentially when the ball and socket joint in the hip is loose, malformed, and ill-fitting. Because of that, it allows a lot of movement that shouldn't be there and leads to a lot of wear and tear and inflammation and eventually arthritis. This most commonly happens in large breed dogs, such as German Shepherds, Labrador Retrievers, Golden Retrievers, Rottweilers, Newfoundlands, and St. Bernards. But it is not just limited to them, because technically it can still happen in small dogs and cats too. Larger dogs are predisposed to this because they are larger and have more weight and more strain on the hips. The severity can vary a lot, and it doesn't always look dramatic, and it's not always your older pets either. Sometimes you may not really notice any signs until later in life when the arthritis gets really bad. There are several signs you can look for, and I'm going to read them from this little note that I wrote, because I know I will not remember to mention everything that I want to otherwise. That can include difficulty getting up, stiffness, reluctance to run, jump, or climb stairs, hind end weakness, limping or lameness in the back legs, bunny hopping while running, swaying through the hips, decreased muscle mass in the hind limbs, shifting weight forward to the front legs, and lower activity level overall. Diagnosis comes from history and clinical signs, exam with palpation and manipulation of the hips, and x-rays. X-rays are a huge part of confirming diagnosis and assessing just how much arthritic change is present. Treatment can be anything from weight management, pain control, and physical therapy rehab, all the way up to surgery in severe cases. There are things you can do that could potentially prevent hip dysplasia, but at the very least lessen the severity of the case that your pet gets. Number one is responsible breeding. Hip dysplasia is strongly genetic, so the biggest prevention actually starts with responsible breeding and screening the parents. Dogs with severe hip dysplasia really should not be breeding. Number two would be keeping weight off of them and keeping them lean, because more weight means more stress on those hips. Number three would be keeping them active and avoiding high impact play, because strong muscles are going to stabilize and protect those joints. Number four would be starting joint supplements relatively early. This will not prevent hip dysplasia, but it could definitely lessen the severity of the case they may get and improve their joint health long term. And the last one I will mention for this video is early detection. This one could arguably be the most important, because catching it early means that they get treated early, and that can slow the progression of the disease, keeping them more comfortable. I'm out of time for this one, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 32 of things that your vet staff wishes that you knew, and in this video we're going to talk about a luxating patella. A luxating patella is when the kneecap slips out of its normal groove in the femur. It can have a wide range of severity, so we grade it on a scale of 1 to 4. A grade 1 would mean that you can luxate the patella manually, but it usually pops back in on its own. A grade 2 means that the patella is occasionally luxating by itself, but usually the pet is able to get it back in on their own. A grade 3 means that the patella is staying out the majority of the time, but it can still be pushed back into place. And a grade 4 means the patella is out all of the time and cannot be pushed back into place. This is most commonly a problem in small dogs such as Chihuahuas, Pomeranians, and Yorkies, but technically any dog can get it, large or small, and cats can too. It's just not as common. This is not typically caused by something like an injury. It's considered congenital or developmental, meaning that your pet was already predisposed and the symptoms are just showing up more with age. In milder cases, you may not really ever notice symptoms of it, but the more it progresses, the more you're going to start seeing discomfort, inflammation, abnormal wear on those joints, and eventually arthritis. Some really severe cases of this may even need surgery to correct it. This can usually be detected and graded just in the exam with your vet, when they're able to palpate that patella and watch your pet's gait and hear a history. They're able to diagnose and grade it. Treatment for milder cases or ones that are not candidates for surgery could look like joint supplements, weight management, because that extra weight on the knees is not going to help, pain control, anti-inflammatory drugs, physical therapy or rehab, muscle strengthening, or exercise moderation. Breeding and screening the parents. It is genetic, and dogs that have luxating patellas should not be breeding. Now let's talk about the things that you can control. First is their weight. Keep them lean because that extra weight is going to increase the odds of developing a luxating patella. Second is starting joint supplements early because that is going to keep your pet's joints healthier overall. The third thing you can do is build and maintain strong muscles through regular exercise because strong muscles are going to stabilize and protect those joints. The fourth thing you can do is avoid high impact jumping. So if they are on a couch, maybe get a ramp so that they're not as tempted to jump off of there. And the last thing I'll mention for this video is early detection. And this could arguably be the most important because early detection means that they get care earlier and that disease is not as likely to keep progressing. That's all I have time for, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 33 of things that your vet staff wishes that you knew, and in this video we're going to talk about a torn CCL. CCL stands for cranial cruciate ligament, and in pets this would be like the equivalent of us tearing an ACL. Here is a quick little picture for reference. The CCL's primary function is stability, so without it, that knee becomes very mechanically unstable. Unlike humans, most pets don't tear it from a single athletic injury. It's usually degenerative, and the ligament slowly weakens over time until it finally fails. Certain breeds are extremely predisposed to this, including golden retrievers, labradors, rottweilers, boxers, newfoundlands, and pit bulls. And you may be noticing that all of those I listed are large breed dogs. They have more weight on those joints, making it more likely, but it's not impossible for a small dog or a cat to have this. It's just far more rare. I think it is really important that you know if your dog tears one CCL, it is highly likely they're going to tear the other one at some point. Signs that this might be happening that you could look for are sudden hind limb lameness, refusing to bear weight, limping after exercise, difficulty jumping or climbing stairs, sitting with the legs stuck out to the side, toe touching only instead of bearing the full weight, muscle loss in the thigh over time, and joint swelling. Treatment can either be more conservative or surgery depending on the severity of the case. Conservative management is more likely to be used on very small dogs, partial tears, and when surgery is not possible. That may include strict crate rest, anti-inflammatories, weight management, physical therapy, and joint supplements, and most of them will still have some instability. For surgery, I'm going to talk about a TPLO, but that is not the only surgery that can be performed for this. It's just the most common and most recommended. TPLO stands for tibial plateau leveling osteotomy. And what that basically means is that the tibia is cut and rotated to change the angle of the bone so the knee stays stable without relying on the ligament. The good thing about this surgery is that it has an excellent long-term outcome. But the downside is that it is very expensive because it is a specialist surgery. If you do go the TPLO surgery route, recovery is going to take a very long time, usually between 3 and 6 months. And the last point I'll make for this video is that if your pet tears their CCL, and even if they get surgery, they are still likely to develop arthritis in that joint. That's all the time I have, so let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 34 of things that your vet staff wishes that you knew. In this video, we're going to start talking about allergies, and we have a special guest. This is Littlefoot sitting on my shirt right now. She felt like being social today, so we'll see how long she actually wants to hang out with me. Don't be rude, tell them hi. Yeah. Allergies usually fall into one or both categories. It's either environmental or it's food related. And because of that, sometimes it can be really hard to pinpoint exactly what is triggering your pet's allergies. Signs your pet is experiencing allergies could look like itching, licking their paws excessively, chewing at the skin, hair loss, red or irritated skin, chronic ear infections, and anal gland issues. Allergies will typically develop over time and don't really get better on their own, so most of what we have to do is manage your pet's symptoms and the triggers if possible.
She's getting antsy, so she's going back in her little home.
Environmental allergies we usually can't control and have to manage the symptoms more than anything. Because if it's a pollen your pet is allergic to, we can't fully get rid of that. We do have more control over food allergies, but it can be very hard to pinpoint which one it is. Chicken and beef are two very common protein allergens that many pets have to deal with. If your vet is suspecting a food allergen, the first thing they may tell you to do is to switch away from beef or chicken as their main protein source and to a different one. If that doesn't fix it, then they may recommend a hydrolyzed protein diet. Basically what that means is that the protein that would normally cause that allergic reaction in your pet has been shrunk down so much that it's safe for them, and sometimes owners keep their pets on this lifelong because they don't want to go through the elimination process of figuring out which protein or proteins their pet is allergic to. Allergy testing does exist, but there are mixed opinions on whether or not it's worth it. It is very expensive, and all it may tell you is that your pet has several environmental allergies that you have no control over. Now let's talk about prescription management. Sometimes it could be antihistamines like Benadryl or Zyrtec, and sometimes just seasonally. In some cases, maybe steroids, but we don't want to keep your pet on those long term. For more persistent allergies, we may do something like Apoquel or Cytopoint, or there is also a newer competitor called Zenrelia that is looking very promising as well. She was begging to come back out. I do want to mention that Zenrelia and Apoquel are both oral and also target the inflammation component, while Cytopoint is injectable, lasts for a month, doesn't have to be given daily like the pills, and it only targets the itch receptors. I'm running out of time, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 35 of things that your vet staff wishes that you knew, and in this video we're going to talk about ear infections. Here's a basic diagram of the ear. Both cats and dogs have similar ear structures with that L-shaped canal with some minor differences. And that little L shape is the reason that moisture and debris can get trapped in there and infections can be hard to clear. For the purpose of this video, there are 4 main things we will see on ear cytology that may be causing an infection. I found this really gnarly looking ear cytology online that has 3 out of the 4. So cocci and rods are both bacteria and yeast is a fungus. And the last one that we will see on cytology that will cause ear infection is ear mites. They are a parasite and they are more common in cats and outdoor pets. Most ear infections start because something irritated the ear first. That could mean having excessive moisture trapped in there from something like swimming or grooming, having a foreign object in there that has irritated the ear. It could mean allergies. It could mean having excessive ear hair, such as poodles and poodle mixes. And it's worth mentioning that if your dog has big floppy ears, they're more at risk of getting debris and moisture trapped inside of their ear. Signs of an ear infection could look like head shaking, scratching at the ears, odor, redness, discharge, pain when touching the ears, holding one ear down, rubbing ears on furniture, and in severe cases, head tilt and balance issues. Let's talk about why you still need an exam and ear cytology even if your pet gets chronic ear infections. The exam allows the doctor to make sure that the eardrum is still intact. It allows them to check for foreign objects and allows them to assess the severity of the infection. A ruptured eardrum especially is going to affect the course of the care. There are a lot of medications and flushes that we cannot give your pet if that eardrum is ruptured. Cytology is important because we need to know what we're trying to kill. If it's rods, it's going to be more difficult. Not all medications will get rid of all ear infections. And for the same reason that ear cytologies and exams are important, we also don't recommend you use leftover ear meds or ear flushes on your pet without at least consulting a vet first. There's still a lot more I want to mention for ear infections, and I'm already past 2 minutes. So what I'm going to do is end this video here and let it be more of the basics of ear infections, and then in the next video we will talk about more chronic and severe cases and some complications. So let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 36 of things that your vet staff wishes that you knew. In this video, we're going to continue talking about ear infections, but specifically the more chronic and severe cases and some complications. If you haven't already, I do recommend going back to watch part 35 where I cover all of the basics of ear infections. If your pet is getting recurrent chronic ear infections, there is usually an underlying cause that we need to figure out in order to best treat your pet. The first one I will mention is environment. That's the one you have the most control over. So if your pet does a lot of swimming, or maybe they got some water in their ears while you were bathing or while they were grooming, or if you're excessively cleaning out their ears, or they're excessively getting foreign material in their ears somehow, those are things we can control that may be causing these chronic ear infections. The second potential cause I will mention is tumors and masses that may be blocking up the ear canal and leaving it more susceptible to having that moisture and that debris trapped in there. The third common cause I will mention is anatomy. So if your pet has some really narrow ear canals, or they have excessive ear hair, or they have big floppy ears, their anatomy is putting them at risk for ear infections. Another potential cause is endocrine disease, such as hypothyroidism or Cushing's disease, because they can change the skin environment, leading to chronic ear and skin infections. And the last potential cause I will mention for this video is often the most common: allergies. And unfortunately, this is another video where I am speaking from lived experience. This is Mickey. He is our youngest dachshund, and he is allergic to life itself. We know he's at least allergic to chicken and probably several environmental allergies, and Buddy cannot catch a break. He gets chronic ear infections. I bring up Mickey's example because he does take daily allergy medication called Apoquel, and most of the time it keeps everything at bay, but there are times where he will still flare up despite it, or if we miss a couple doses. There are times where we take him in because he's acting like he has an ear infection, and there's no debris there. The ears are just inflamed. So they are not yet an infection, but it will probably lead to one if it's not treated. But that can happen too in allergies. Believe it or not, I'm running out of time again, and I still have more that I want to talk about when it comes to ear infections. So I guess this video will just be chronic ear infections and their potential causes, and the next video we'll talk about surgeries. Thanks for letting me yap about ear infections. Let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 37 of things that your vet staff wishes that you knew, and in this video we are going to talk about ear surgeries and complications. This is the third video that I've done on ear infections, so if you have not seen the previous two videos, I do recommend you go watch those, because for this one specifically, they have kind of built off of each other. I'm bringing back this little diagram again, because for the purpose of this video, I need you to know three parts of it: the pinna, the vertical canal, and the horizontal canal. There is one complication in particular that I do want to mention for this video, and that is an oral hematoma. An oral hematoma will happen when your pet is shaking their head so frequently and so violently that they burst the blood vessels in the pinna. This causes blood to fill up the space between the skin and cartilage. And here is an example of one, so you can see how ballooned up that ear looks. Treatment for this usually looks like draining it, suturing it closed, and putting on some no-flap ear wrap on them, but in some severe cases, maybe surgery. The second complication I want to talk about is chronic ear canal changes. So basically, after a bunch of long-term inflammation and repeated ear infections, it can cause thickening of the canals and scar tissue. It will progress to a point that eventually the canal stops functioning normally, and medication can't even reach the infection anymore. When it gets that severe, that is usually when surgery is needed. And for this video, we are going to talk about 3 different ear surgeries. The first surgery I will mention is an LECR, or a lateral ear canal resection. This surgery removes the lateral wall of the vertical canal, not the entire canal, but it opens it up. By doing that, it allows for better ventilation and drainage of the ear canal. The second surgery I want to mention is a VCA, or a vertical canal ablation. This surgery removes the entire vertical canal, but it does leave the horizontal canal intact. The horizontal canal becomes the new opening, and it is typically only used when the disease is limited to just the outer canal. The last and final surgery I will mention for this video is a TICA surgery, or a total ear canal ablation. And that is exactly what it sounds like. They remove the entire canal, both the vertical and the horizontal. It's almost always paired with an LBO, and that is a lateral bulla osteotomy. And that basically means that the surgeon opens and cleans up the tympanic bulla, or the middle ear. And don't let those scare you. They sound scary, but if your pet has had chronic enough ear infections that they needed this surgery, they are going to feel 10,000 times better afterwards. And I finally covered everything that I wanted to for ear infections. So let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 38 of things that your vet staff wishes that you knew, and this video is going to cover anal glands. Let's first talk about what anal glands are. Anal glands are scent glands. That is their primary function. They are located just inside the anus at roughly 4 and 8 o'clock. They produce a very strong smelling, oily fluid that is used for territorial marking, individual scent identification, and communication between animals. In an ideal world, they should be expressing them themselves. Firm stool passing through the rectum puts pressure on the sacs expressing them. It doesn't always happen that way because it's not a perfect world, so signs that something isn't quite right that you could look for is scooting, excessive licking of the rear end, a fishy smell, sudden leaking of brown fluid, swelling near the anus, and pain when sitting. The most common reason that pets will end up with anal gland issues is because they're having soft stool. That could be because of chronic GI disease or frequent diarrhea or poor diet, such as things like not having enough fiber in the diet. And the other most common reason for anal gland issues is allergies, and that can be environmental or food allergies. Their anatomy could also be putting them at risk for more anal gland issues if they are a small breed or they're overweight. And it's worth mentioning that anal gland issues are more common in dogs than they are in cats, but not impossible. When your pet has to get them manually expressed, it will either be external or internal. External expression usually happens at places like grooming, and when you go to your vet office, we express them internally. External expressions are not as effective as internal expressions at emptying out the anal glands fully. Routine manual expression is not recommended because frequent manual expression can irritate the glands and cause inflammation, which can make them more likely to have problems later. It can create scar tissue, leading to less effective drainage. The gland may start producing thicker material, or they may become dependent on it entirely because they stop emptying them efficiently on their own. While it's not necessarily wrong to do external expression, it is more likely than internal expression to irritate those anal glands. Part of that is because a portion of the anal gland material often still remains inside the sac, and that can allow it to thicken over time and to continue to build up. Another part of that is that there is not as much pressure control with external expression. And by that, I mean internal expressions are able to actually palpate and feel the anal gland more efficiently and able to dictate just how much pressure is needed, whereas the external expression may use more force than necessary. That's all I have time for on this one, so I will do another video talking about anal gland issues specifically, but let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 39 of things that your vet staff wishes that you knew, and we are still covering anal glands, but this video is going to talk about anal gland issues. Before I get too deep into the issues, there is one little tidbit of information I wanted to include in the last video but didn't get to. And it's that solid stool is not the only way that your pet can express their own anal glands. They can also kind of skunk spray you. Now, it typically only happens when they are very scared, stressed, or excited, but it can be quite projectile when it happens. Now let's move on to talk about the anal gland issues themselves. Typically, anal gland issues will kind of progress through stages and get worse if they are not taken care of early, but you can also have cases that are kind of abrupt and happen really quickly. The first stage of anal gland issues we will usually see is impaction, and that happens when glands aren't emptying properly and the material inside begins to build up and thicken, and that thick material can block the ducts that normally allow the gland to empty. Unless it's recurrent, usually all you have to do in this situation is go to your vet to have a manual expression done. The second stage we may see is infection. So if the gland stays impacted, bacteria can begin to grow inside the sac, and that material that we express is no longer going to be normal. It may be yellow, green, bloody, or pus-like. If they get to this stage, treatment might look like a manual expression and some antibiotics to clear up that infection. And then the third stage we may see is an abscess. So if that infection is allowed to continue, pressure is going to continue to build up inside that gland until eventually it ruptures through the skin. Here in a second, I am going to show you a picture diagram of an anal gland abscess that has burst. If you do not want to see that, skip over this part. Here is that diagram, and you can see that this dog actually had both anal glands rupture. Treatment for an abscess is usually going to involve sedation so that we can get a better look at it, and if it has not ruptured already, we can lancet, drain it, and flush it, and we will usually send home antibiotics as well. And lastly, in some very severe chronic cases of anal gland issues, we may recommend surgery to remove them entirely. The surgery itself is called an anal sacculotomy, and this is not done lightly. It is usually always very severe cases that this will happen in, and that is because the anal glands sit very close to the nerves that control the anal sphincter and continence. I'm running out of time, so that's all I'm going to cover for this video and for anal glands. So let me know if you have any questions or suggestions. Love you guys. Bye. Welcome back. This is part 40 of things that your vet staff wishes that you knew, and this video is going to be a little bit different. For this one, we're going to do a rapid fire recap of 40 things we've covered so far. Vaccines save lives. Prevention is easier than treatment. Prevention only works when you give it consistently. One flea can turn into hundreds fast. Ticks spread disease. Heartworms come from mosquitoes. Indoor pets can still get parasites. Obesity shortens lives. Portion control matters. Many pets need fewer calories than owners realize. Bad breath isn't normal. Dental disease is painful. Dental infections can spread through the body. Pets hide pain very well. Limping is not normal aging. Behavior changes could mean pain. Arthritis becomes more likely with age. Arthritis is degenerative. Hip dysplasia is genetic. Large breed dogs are more prone to hip problems. Luxating patella is more common in small dogs. If your pet tears one CCL, they are likely to tear the other one at some point. Back injuries can happen suddenly. Ramps help protect long backs. Start joint supplements before you see symptoms. Allergies are rarely simple. Chronic skin, ear, and anal gland issues could mean allergies. Chronic ear infections cause damage. Severe ear disease could require surgery. Anal glands can become infected and abscess. Not all foods and medications can be shared with your pet. Some common plants are very toxic to pets. Your pet acts differently at the vet than they do with you. Our number one priority is to keep everybody safe. Fearful pets are not bad pets. Sedation can sometimes be the kindest option. Taking your pet to the back can help us work more safely. Pets are expensive. Pet insurance can be great if you get it early. And last but not least, your vet staff does truly care about your pet. And that is our rapid fire recap of 40 things your vet staff wishes you knew. So if any of those piqued your interest, you can go back and watch the other 39 parts that I've done. But that's going to be it for this video. So let me know if you have any questions or suggestions. Love you guys. Bye.